My name is Andrew Wax. I'm a CPS, Certified Peptide Specialist. I'm myself, Dr. Elizabeth Yerth, Brian Graham are here at Boulder Longevity Institute. I work with a lot of athletes who are looking for ways to optimize their endurance performance. A lot of bodybuilders who are also looking for sort of that anabolic factor. And then there are the people who are looking to maybe drop a little bit of weight. That's the scenario where we're implementing a lot of the ketones with recovery. I typically advise people for any sort of endurance sport, empty stomach, 10 milliliters right beforehand, 30 minutes or so. And that pairs really well with a lot of the peptide stuff. Your ketone ester, you do a really great job of, well, now we can get glucose down to a manageable level and we get insulin down. So this is the diabesity type people, the diabetic and obese related.
Frank Yosa here, CEO of Ketone Aid, and today I'm going to have a wellness center expert, Andrew Wax, who's a CPS, and it has to do with peptides. We'll talk about what CPS is and what they're doing with peptides. And honestly, I'm kind of embarrassed that I don't really fully understand what peptides is. So hopefully I'll get as much of a lesson as everyone else watching this.
I'm
hey,
happy
Andrew,
to
join us.
answer any and all questions.
Yeah.
So like Frank was alluding to, my name is Andrew Wax. I'm a CPS, Certified Peptide Specialist. I'm myself, Dr. Elizabeth Yerth, Brian Graham are here at Boulder Longevity Institute, are part of the first cohort to complete a peptide certification through the American Academy for Anti-Aging and Regenerative Medicine and International Peptide Society, led by Dr. William Seeds. We originally found Frank through his Ketone Ester product, which we've actually come to really appreciate. And
right, well, we're gonna just real briefly, so people are like, where is this going? We will circle back and find out, how are you guys incorporating esters with your users and how does that work?
Sure.
So we will get back to that.
All right.
Go on.
So peptides. So at Boulder Longevity Institute, we pride ourselves in being the sort of the latest and greatest. All I do all day is just research peptides and then consult with patients about how to implement them in a customized protocol.
What is peptides? Can you go even
peptides? Peptides, yeah, just a general overview. Here, let me. So short chains of amino acids, right? So consider that you could consider them tiny proteins. Anything 2 to 50 peptides, amino acids is a peptide. Anything 51 to 100 is a polypeptide. Anything over 100, that's a protein. So really you could consider it a tiny protein. Truthfully, nearly all communication in your body is a result of peptide signaling in some way, shape, or form. So consider that you have over 7,000 of these in your body that serve some purpose. They can increase your production of growth hormone. One can make you tan. It's just, you consider any biological process, biochemical process, we can probably modulate it with peptides. They function by either binding to cell surface more often than nuclear receptors, but bottom line, they have a very short half-life, and that's wherein their safety profile lies. They're potent, they're safe, they're very specific. One peptide that I like to go into with people, peptide that everyone really knows of, is insulin, right? So consider insulin was...
Okay, insulin's a peptide. Okay, that gives a great framework.
Right. So that's where I like to start with people. Insulin's a peptide, signaling molecule. Consider its mechanism of action. Peptides are homeostatic in nature. They maintain sort of a normalcy. So consider insulin, right? You have a release of glucose from some meal that you eat. It targets muscle, fat, and liver tissue. Insulin binds a cell surface receptor, subsequent release of glucose transport channels, and then glucose is taken up into the cell. So then thereby you have regulation of blood glucose by this homeostatic peptide hormone, insulin. So consider the progression of peptides over time. Originally, we've got this inception of peptides. Like 1921 is when insulin was originally founded, isolated from pigs, and then from there it it's blown up in the last 15, 20 years. So consider longevity, athletic performance, aesthetics, cognition, immunity. It keeps going. Cancer treatment. It really just keeps going and going and going. It's probably the most quickly emerging field of, that medicine has to offer today.
I think about it for if someone has an injury like chronic knee pain and they just can't get the knee to regenerate, that they would somehow inject peptides into that knee.
Yeah, so I mean, it depends on what the injury is, right? So certainly you could consider if somebody, injures their MCL, medial collateral ligament. Well, that's a ligament. And in injuring it, it's extra articular from the joint, so it has good blood flow. Typically, that's going to heal on its own. But how do we hasten that recovery? There's certain peptides that we can introduce that you can inject on a daily or multiple times a day basis, because again, very short half-life. Consider diabetics and insulin. They have to inject these things frequently to get a response. So your MCL is injured, and we want to hasten that recovery. So what can we do? We can upregulate your production of growth hormone. Huge, great for then targeting insulin-like growth factor downstream from that. And then you're able to ultimately get great benefit from healing factors. But consider that there are other peptides that target vasoactive endothelial growth factor, VEGF, and are modulatory to it, which will even to a greater degree, initiate a healing cascade. So BPC 157 is a peptide that a lot of people know of and is very popular now. For all intents and purposes, BPC has been found to be probably one of the safest peptides, not really any contraindications to using it. It can target neuroinflammation, it can target healing. In this particular scenario, you've injured your knee, we would inject it on a daily basis or multiple times a day, depending on what the patient's willing to do, to initiate this healing cascade. I had a patient here with me today who just had a surgery on her hand, and we're implementing several peptides for hopefully regenerating her cartilage in her knee. She has arthritis. So she didn't plan to have the surgery on her hand, and it just sort of coincidentally happened that way. And she came in and she goes, "Oh my God, look at my hand. It's healing so rapidly. I've never healed so rapidly in my life." And I was like, "Yeah, peptides are amazing." And she walked out and goes, "Yeah, peptides are amazing." So
is it anything like steroids? I mean, I've seen someone who would come into a traditional doctor might say, "Let's get some local cortisol steroid." Is a steroid a type of peptide or?
No, so it's a steroid hormone. So cortisol, hydrocortisone, so consider that cortisone is catabolic in nature. It works through catabolic pathways to essentially decrease inflammation, and it's ultimately a band-aid. It doesn't initiate any sort of healing cascade. Certainly, it can disrupt sort of an inflammatory cycle. Someone comes in and they have a lot of inflammation in a joint or something's going on. Sometimes you need to introduce some steroids so that you can really get everything calmed down and then work on healing and strengthening and everything from there. But ultimately, serial steroid injections, very different from utilizing peptides. Peptides think regeneration, think anabolism, building. Whereas steroids in the, not anabolic steroids, but rather catabolic steroids, where you get a steroid injection, maybe a steroid taper, that kind of thing is proven to be less and less healthy. Whereas peptides, there's, totally different thing.
We've seen with people who are on steroids and the ketogenic diet, there's some strange things that go on there where it actually keeps the blood glucose up, which is ironic because you're trying to keep inflammation down. So I've seen some people that want to use esters or a ketogenic diet because they're like, it's anti-inflammatory, it lowers blood sugar. But ironically, the steroids increase.
Are going to counteract that. And that's the other thing is, using cortisone or, these catabolic steroids in diabetic patients it's a significant risk. They're elevated blood glucose for several days and even weeks after an injection. You don't see that with peptides.
Wow. Okay. Yeah, I can see that being beneficial. Now, do you think it's being accepted by more practices? I mean, I'm embarrassed by how little I know. Is this really on the fringe, new stuff that everyone?
Yeah, I mean, it's pretty new. It's hitting pretty hard with the biohacker community, and it's gaining traction there. But It's pretty new.
More
widely
in the ketogenic diet, like as far as crazes and stuff, is how does it compare to ketogenic diet? A lot of doctors still see that as fringe craziness. So is it in that category, or is it newer or more well established than keto?
I would say it's not the standard of care, right? So you go in and you see your primary care physician. It's unlikely they're going to say, "Oh yeah, peptides. This is what you should be doing." Very few people. We're probably the first medically managed peptide program in the United States, and we are the first medically managed peptide program in the United States. And ultimately, what we do is we guide people through some of these things that maybe aren't necessarily FDA approved. So then there's some controversy there. So it's not, it will gain traction, and it's gaining traction rapidly, but still not mainstream.
So how does someone find out about you? How does someone, if they go to the doctor and the doctor isn't, they only prescribe what they learned 15 years ago, and they tend to not really read papers anymore and do research. They tend to just, go with the common what they learned 15 years ago. How does someone find you? Do they tend to find you through, the chiropractor is like a network where it comes in, or just the biohackers have to be super early adopters to even know that you exist?
So Dr. Elizabeth Yurth is she's a physiatrist, sports medicine physician, and non-surgical spine specialist. That's part of her practice. And then she has this other practice, which is Boulder Longevity Institute, and they cross paths frequently. So a lot of what we do here is functional medicine. We have a very skilled nurse practitioner who does the majority of our functional medicine practice here. Her name's Tammy Caillou. And she works through supplements and hormones, and I'm sort of more the research stuff, peptides, some other novel treatments. And a lot of what we do is orthopedic related. So when patients have failed traditional, modes of treatment, at the orthopedic clinic, it's they say, well, let's try some other stuff. Let's see what else we got. And then ultimately you say, well, let's try peptides. And Dr. Yurth will lay out options for patients and go that route. And luckily, she's the doctor that is constantly reading and constantly up on new research. And you just need to find the up and coming physicians. You need to find the people who got into it because they love the science and they love to learn.
Is it something like that 5 years ago people would jet off to Mexico because it wasn't allowed in the US? Is any correlation? Are they doing peptide stuff, or even more shady, more risky peptide stuff where you're not willing to go over that line, but they are? Like, this is what it sounds like this. If everything else has failed, you go to Mexico and you.
No, I wouldn't say it's if everything else has failed, and that's a very particular scenario where we're talking about orthopedic conditions. A lot of peptides are gaining traction for longevity. If you consider that just growth hormone in and of itself, by the age of 30, you've lost 15% of what would be considered normal growth hormone release. Consider about 25 as normal growth hormone release, where you're sleeping, healing, you feel optimal, everything's great, and then it kind of goes downhill. If you consider all the things that growth hormone targets, it's a huge list here. Let me rattle off a few things off of this list. A low level of growth hormone, you're predisposed to increased disease state, obesity, sarcopenia, muscle wasting, osteoporosis or loss of bone density, malaise, lethargy, cardiovascular disease, poor cognitive function.
Yeah, I was going to ask you about brain. Can you go into brain and peptides?
Yeah, absolutely. Truthfully, we probably don't have enough time to go through everything. It's a huge body of research. But certainly, you consider peptides and cognition. There's a lot of research on peptides and treating neurodegenerative disease, but also nootropic peptides, right? So one that people really like and that is more mainstream is CMAX, SEMAX. It's an intranasal peptide. It's adrenocorticotropic in nature. It's a little bit of a stimulant, I guess you could say. And is something that people really enjoy using. It's intranasal, which is great because a lot of these peptides are injections that you have to administer to yourself. So people can get great benefit from utilizing something like Cmax with respect to cognitive acuity and recall. There's also some evidence that it helps with cardiovascular disease. Yeah.
And they're allowed to use this for treating disease? I mean, that's the
yeah, so
I mean,
there are some disease states that you can actually absolutely treat with Cmax. It really just comes down to what the patient's goals are and what they're trying to do. A lot of times you can utilize something like Cmax as just a nootropic. Somebody who's just looking for a little bit of cognitive, an acuity boost. But there are people that come in and say, I've got declining memory recall. I testing positive for some of these Alzheimer's exams. And then you consider, well, what are some of the clinical applications of Cmax then? Well, memory, anxiety is one of them, which is great. Mental fatigue, traumatic brain injury is huge, or stroke, nerve regeneration. So anybody who's had a concussion, this can be great. ADHD, opioid withdrawal is actually, and alcohol withdrawal is actually huge with Cmax. Alzheimer's, Parkinson's, ALS, MS, autism.
So are these
kind of runs the gambit.
Are these prescription drugs? Do they count as drugs, or how does one?
Yeah, you have to classify peptides as drugs. These are written as a prescription from a physician that you ultimately get from a compounding pharmacy. We use tailor-made compounding for all of our stuff. We think that they are far superior to the other accredited pharmacies out there. Very high level of purity and sterility. We know the product that they're shipping out to patients. In general, I would say it's irresponsible to sort of Wild West the whole thing and go your own route.
Yeah, no, I respect that. I just didn't know what the classification of it was, whether you had it there at the center and you would give it to them, or whether it was classified as a drug.
These are all very specific prescriptions. They have the patient's name on them. Just like if you were to go to pharmacy, it's just the only difference is that it's mail order.
Now, do you ever work with people remotely? Like, I'm already thinking about, well, I could always use help on this and this and this.
Yeah, absolutely. So I have a Dr. Yurth is licensed in several states. So Colorado, obviously, we've got California, Nevada, Arizona, Idaho, Illinois, Wisconsin, and Utah. We're always adding on.
I gotta move, or you guys have to add Virginia to the list.
So there we go. Or you can come out and visit us.
Yeah.
So there's definitely a role for medical tourism. So patients want to come out and see us for, spend a couple days here. We'll do a full workup. We'll do lab tests, make sure everything is good to go for you. And then after the fact, you can say, well, this is really academic and educational, or you can say, yeah, let's move forward with some peptides, see how this goes.
Very neat stuff.
Yeah.
So I'm also curious, obviously, with the Ketone Ester, you found out about us through Dr. William Seeds, who's like a huge fan of it. He's not the type of doctor that is on many podcasts. So if you go to YouTube, I don't even think that he's on there. So I'm dying to get him on a podcast, but he will do presentations to entire auditoriums of people that are in the peptide field. So he's known in the field, but he's not necessarily Google searchable.
He's hard to track down.
Yeah. So I'm dying to get him on the podcast. But so he mentioned that he uses it for recovery. That's his main thing. I contacted him and actually told him that he was using what I thought was 2 to 3 times too much. So he cut back, and he's like, hey, I'm getting the same great results, and you just saved me, I don't know, $10, $20 a day.
Absolutely.
He's a big fan of it. So how are you guys incorporating this? Are you just, everyone that walks in, you give them a small bottle of, Ketone Ester on the way out, or like, how do you guys incorporate it?
So no, it's very patient specific and it has to do with patient goals. I see a lot of athletes. I work with a lot of athletes who are looking for ways to optimize their endurance performance. So ultimately, they're walking out and saying, okay, here's what we can do. Here's a way we can do it. I typically advise people for any sort of endurance sport, empty stomach, 10 milliliters right beforehand, 30 minutes or so. And that pairs really well with a lot of the peptide stuff. Certainly, I use it less for recovery, only for recovery if people are looking specifically for anabolism. So I work with a lot of bodybuilders who are also looking for sort of that anabolic factor. So anybody that is looking for that, we say, well, post-workout would be a really good option for you to use these, pre and post-workout. And then there are the people who are looking to maybe drop a little bit of weight. There are peptides that actually are glucagon receptor antagonists. So then we're limiting the amount of glucose that you're producing from your liver, because glucagon ultimately goes down that pathway. And then if you pair that with your ketone ester, you do a really great job of, well, now we can get glucose down to a manageable level and we get insulin down. So this is the diabesity type people, the diabetic and obese population.
What protocol do you use for them? 5-10 minutes twice a day?
They're doing, up to 10 milliliters every 2 hours.
Oh, wow.
In some cases. But more often than not, it's what people can afford and what they're willing to do. Because while it's the flavor is good, but it's still very scary cherry. People see results, but it takes. They're doing 3 times a day, probably.
Do you find that does it somehow multiply the peptides? Because we know with like drugs like caffeine, if someone has just a little bit of caffeine, they might say, "Oh, well, I normally don't notice caffeine." Then they take the ester and like, whoa. And I tell them, I'd love to take credit for that, but it's the caffeine that suddenly got delivered to the brain. Is there any interaction with the peptides where it increases the effectiveness?
I don't think it necessarily increases the efficacy. If you look at the pathways of how it goes, a lot of what we're using is what's considered a growth hormone secretagogue in terms of peptides, something that will upregulate your production of growth hormone a little bit. And in order to do that, we need to have unbound ghrelin receptors. A while back, you sent me an article about how your ketone ester will actually bind ghrelin receptors and ultimately put you in a satiated state. So it's an appetite suppressant, which is great.
Right.
But when you're trying to release growth hormone, you want those receptors to be unbound. So it's a little bit conflicting there. So you need to make sure that so if you're using for anabolism and recovery, well, immediately post-workout, you should do your growth hormone secretagogue injection, which allows you to pulse growth hormone for a little while. Then 30 minutes later, that's when you would want to implement something like ketones, because then you've given yourself enough time to release and secrete this growth hormone effectively so that it can target tissues, fat for lipolysis, your liver for increase in insulin-like growth factors so you can recover. And then after that, that's when let's throw in these ketones. Let's maybe combine those ketones with a complex carb of some sort at a high protein meal. That's the scenario where we're implementing a lot of the ketones with recovery.
And are your people mostly regular Western eaters? Are they mostly keto, or the same protocols whether they're keto or not?
It's all over the place. Most of the time, what we're doing is more of a diabetic diet, more Mediterranean, low glycemic index. We do have a few people that are saying let's go keto, let's do it. It's hard.
You really nailed it. You really nailed it. What I have is my beta weight loss program, which I say, this is not a weight loss drink. My wife says I can't sell it as a weight loss drink, but I do that. I do a diabetic diet, not a full keto diet because it's too hard for many people. But if you limit those high glycemic foods, and I have a list of 5 things that I call, the 5 deadly sins. If you just avoid fruit, rice, bread, pasta, and then I say fruit again, because fruit is the devil. And then I have a half an hour discussion about fruit. And I have a whole video on how fruit's the devil if you're trying to go low carb. Even if it's organic, gluten-free fruit, it's still going to make your blood glucose spike. So hearing you say it with your background that, keto might be better, but at least the devil is this, glucose spikes and what it does with, I think it stores free fatty acids. It does counteract the effectiveness of the ester. Do you find that the protocol has to be tweaked at all with people that are keto? I found that people have to take or can take far less. Somehow they have either the MCT transporters or they recognize the fuel much quicker and they can take less.
Certainly less is, with keto people, less is more. They get a much more significant effect from it. I found that the keto people respond better to the ketone esters in terms of performance. A lot of my people, if you're not on a diabetic type diet or something with a very low glycemic index, I found that a lot of people are going hypoglycemic if they're utilizing the ketones for performance.
Right. Yeah. So they need to have the dual. They need to either cut back if they go hypoglycemic. They need to either cut back the quantity up front, or do a slow release where they put it in their water, slowly releasing it, or do the dual fuel where you do a bolus of glucose first, you get that spike, and then you do a bolus of ketones, or you can do some UCAN or a combination of fast.
And in those scenarios, well, that's exactly what we do. So it's, people who are running on sugar, hey, if we still want to get this performance benefit, let's throw in a little bit of UCAN and then go and combine them together and go from there. A lot of the athletes I'm working with are doing high intensity interval training, or are doing hours and hours of cycling, climbing, boulder. You kind of run the gambit with the athletic community here.
Yeah, well, rock climbing, just to not have that lactic acid build up in the arms. I came from a rock climbing background, camp counselor.
One thing I recommend with anybody who's taking any of the ketones ever is adding in some sodium potassium bicarbonate in one way, shape, or form, just to replenish your electrolytes, and then also further combat that lactic acid buildup, sort of neutralize it a little bit.
Well, it's actually great that you brought that up. We did change the formulation from the initial batch, and we did add sodium and potassium as well to bring up the pH instead of being a 3.5, 4.0 drink, making it more neutral at 7. So we did add some, but I have told people that you actually can combine it with ketone salts if you're so inclined, non-racemic ketone salts, but don't combine it with MCT oil. But if you want to combine it with the salt, that's fine. But really add in those electrolytes. People have been asking about that for a while, and that's our next drink coming out called Ketone Water, where we actually half Ketone Ester, half D beta hydroxybutyrate ketone salt. So the electrolytes are much higher. So it's good to hear that you're telling people to add that.
It's almost anyone. Most people are going to run acidic regardless. And if you look at the benefit for recovery and sort of arthritic pain, and following sort of this more alkaline diet, or going with something like sodium potassium bicarbonate, or even just baking soda.
Yeah, I mean, literally, you could put, if you have one of the trainer bottles like this, you could add a teaspoon of baking soda. Now, do it slowly because it will become like a volcano, like your kid's science project with vinegar and baking soda. It'll bubble over. But you can add a teaspoon, not a tablespoon, a teaspoon of baking soda to raise the pH, and actually it makes it taste a little bit better. But
right on.
I didn't really talk too much about that.
Yeah, I mean, people typically get through the flavor. It's not a.
Are they diluting it? Are they doing I recommend a 1 to 3x dilution to take it.
Yeah, no, most people are not diluting it. Most people are just going for it, and they say, yeah, I deal with it. It's like I'm back in college taking shots of cherry vodka.
Right.
Or it's cough medicine all over again. Throwback to my childhood. Most people deal with it.
My wife, I like to dilute it 1 to 3x. My wife says I'm a wimp, and she likes to take it straight. So
yeah, I take it straight.
What about sleep? Have you had your people or yourself personally take it for sleep, and do you have an Aura Ring?
So Aura Ring is on the way. Plan to use it. Have not used it for sleep personally. I know a few of my clients have, and have had good results with it, especially cancer patients.
Okay.
Use a lot in cancer patients.
We're talking about like super low amounts though. Like I just had on a message board, someone texted me saying, hey, I had horrible sleep. And I said, and she showed me the data, and I said, how much did you take? And it was a woman, and she took 5 mLs. And I said, hey, please go to our Facebook message board and post the negative too, and we can discuss there what happened. But she took 2 to 3 times too much.
Yeah. So we're doing, it's typically 2 or 3 mLs.
Yeah.
And unfortunately for a lot of our cancer patients, they're very gaunt and tiny people with all of the treatments they're going through and all the different diets and everything that they're trying to shut down those pathways. They're very, very low mass. So, this one woman that I'm considering is about 90 pounds. So she does 1.5 to 2 mLs, and that's good for her. And she's able to sleep, but ultimately we're just looking for the anti-inflammatory and anti-cancer benefit associated with it, as opposed to actually targeting sleep. Right.
So I find a male to female, it's also based on weight, but for the most part, males 5 mLs usually is good, and then for women half that, 2.5. But we have some people like Travis Christofferson who first brought this whole concept of sleep to me. Like, people are thinking, how does this drink that gives you energy help you go to sleep? But it's a calm energy, so that's a strange thing. But he takes as much as 15 mLs before bed. And when I take too much, I take 10 mLs, it'll make me have a shallow sleep. So it's not good. But if I know I'm only going to have 3 or 4 hours of sleep, either going to sleep really late or waking up really early, I can actually increase the amount. I don't even want to say the amount that I do because I don't want other people to try it, but I'll increase the amount. I'll wake up 3 hours later for that flight. My wife's like, how many hours of sleep did you get? And I was just completely fine. Now, it did catch up to me, but it was, no big deal.
Yep, I know, absolutely. And I think I think there's a lot of room for trying a lot of things with sleep. Here, what we primarily use are peptides for sleep. So we're targeting sleep through suppressing cortisol, again, by increasing release of growth hormone just for a brief amount of time. And then, because ultimately your cortisol release is inverse to growth hormone release. So if we can get you to pulse a little bit of growth hormone, we can suppress cortisol, you go into a deeper sleep and then optimize essentially deep sleep and REM sleep.
Well, that's exactly what happened to one person who, a friend of mine who had a cortisol spike 2 or 3 a.m. and would wake up and then be up for 2 or 3 hours. And he just started taking a small amount of ester and he didn't have the spike. Now for him, I said, you should go ketogenic for his other, issues that he has. And I don't even know if he uses the ester anymore before bed. It doesn't matter. But because the ketogenic diet made it so that he didn't have the cortisol spike and, saved him a bunch of money.
Yeah, I love stories like that, and especially with the Oura Ring, when people can bring in their data and say, look what happened, look what I did. So which is why mine's on the way.
Yeah, we had one person that had 6 minutes of deep sleep one night on Monday, and this is on the Oura Ring, not the Fitbit and the Apple Watch. It's just not nearly as accurate. And then so day 1 Monday 6 minutes, day 2 with ester 60 minutes. And then day 3, no ester, 12 minutes. And she was floored.
So and then we get very similar results. There's one of our employees here, she started using a few different peptides for sleep and saw very similar results on her Oura Ring. So as soon as we hang up, I'm going to tell her she needs to start pairing with some ketones and see what happens then.
Yeah, I think one theory, we're not quite sure exactly why it works. We know it works for recovery, and sleep is a big part of recovery, but that it increases NADPH. And somehow that aids the absorption of the natural melatonin that your body's already getting. Now, I would be hesitant to mix it with exogenous melatonin, externally consumed melatonin, but that is one theory for why it works. Do you have any other thoughts on why it works?
Truthfully, no. I could spend about a day researching it. I've not gone into it in depth. In a few different ways, it makes sense. Decreasing insulin, just less inflammation, lower cortisol, and ultimately better sleep.
Yeah. Now, if any of your athletes travel overseas, Dr. Mercola thinks that we are crazy and shouldn't be selling this as a sports drink or for ketogenic diet people. He thinks it should just be for jet lag. And the jet lag protocol. If you ever have athletes that are flying to Europe or overseas, we've had experience where people flew from New York to Australia, no jet lag with the ester, and then another person went from the Middle East to Australia, and again just no jet lag. So keep that in your arsenal as well.
Absolutely. Yeah, no, and again, we use peptides for that. Okay. There are a lot of peptides where, very specific peptides targeting very specific pathways. So there are pineal gland peptides that are ultimately, it's kind of like melatonin on steroids is a way you could consider it, where somebody is jet lagged, they come in and get an IV infusion and ultimately combat that jet lag and get your circadian rhythm in check with a few different peptides, so administration of peptides, you can go via subcutaneous injection, you can do IV, you can do oral, which isn't terribly effective just because of the short half-life. And you end up spending a lot more money because you need more. Yeah. But an intranasal, a bunch of different mechanisms are out. In this scenario, we primarily do IV administration.
And is all these peptide things all WADA compliant? I think WADA would allow anything to be IV.
Nope.
How does it work with WADA?
So WADA, USADA, a lot of these peptides are banned substances. So you have to be very careful with athletes so that you can direct them down. What can we use? What can't we use? It's a
So
very
there's some that you can use. There's some if you have a knee
Oh,
problem.
absolutely. And the one that I mentioned before, BPC 157, yeah, it's remarkable in its ability to help with neuroinflammation, recovery, pain. It's I joke, it's like the better ibuprofen. Healthier, less risk. No toxicity dose associated with it, no real risks there. So if you strain something, you hurt a ligament, and you want to use it sort of on an as-needed basis, great. Some people just say, I'm going to do this injection every day because it makes me feel so good.
You make me want to make a special trip.
Yeah, come out and see us. We're happy to have you.
Absolutely. Well, what else? Have we missed anything else on, ketones, diet, ketogenic diet, peptides? Anything?
I can go on forever about peptides. It's as much as you want to know. Truthfully, with exogenous.
What about hair? What about hair? What does it do for?
Yeah, we do. There's a hair protocol that just came out with several different peptides to help reverse androgenetic alopecia. So when you're converting too much DHT, dihydrotestosterone, and ultimately causing hair loss in men, there are different peptides we can use to basically target every possible pathway to get hair regrowth and ameliorate or save the lost follicle.
Wow, I wish you had told me before I got what looks like a slashed head open here, where they took out an inch out of the back and then they brought it up to the front, and it's still like this. So it used to be more shiny. So it's all relative. Wish I'd known about that before.
You can still give it a shot. We'd be happy to work with you.
All right. Well, thank you very much.
All right. It was nice to speak with you.
Bye-bye.